Hello, Zoltan here from Adagio Hands, releasing stuck bodies. Do you ever wonder which practitioner, which therapist, which clinician you should go and see when you have a niggle, a tension, a pain in your body? In this video, we're going to look at how to make that decision between the range of manual therapists, the most common manual therapies that are out there. To start with, let me just highlight two principles. The first is the relationship with the practitioner. There's a statistic out there that over 70% of the effectiveness of a treatment depends on your relationship with the practitioner. So it's worth just checking out who you're going to see. Look them up on websites. If you have a chance, speak to them and see if they talk your language. Do you feel listened to? Do you feel they understand your problem? Do you feel an intuitive trust with how they go about things? If you do, fantastic. If you don't, chances are you're not really going to take on board what they say. You're probably not going to commit to the exercise they set you. Chances are you may not even go back, and therefore, of course, you're not going to get better. So that's the first thing. Make sure you find someone that you just warm to, that you think, yes, this person's really going to help me. The second key principle is what modality, so what kind of therapy are you drawn to? Are you drawn more, for example, towards exercise? Are you drawn more towards anatomical explanations and figuring out how things work? How are you drawn to hands-on work, to touch, to being moved around? And then what about injections? What's your take on medication? All those things, again, your mind, your body will intuitively be drawn to some modalities more than others. And remember, there's several ways to skin a cat. There's not just one way of resolving conditions. So have a think about what appeals to you and then try to match that with the therapist that appeals to you as well. And then those two principles will stand you in good stead, will give you the confidence and the commitment to see things through and resolve your condition. So I hope that's helpful, and we're going to move on now just to a quick review of the various manual therapies. So what I mean is hands-on therapies that are out there, most commonly out there. Let's start with a very common one, physiotherapist. Medically trained, highly trained, and physiotherapists not only treat you manually, but they are also qualified to, for example, prescribe medication, to give injections. And they will also focus on the strength in your body. So when there's an area of weakness, they will look at how to strengthen the surrounding muscles, the surrounding tissues, in order to allow the weaker areas to take a break and then gradually strengthen themselves. So that's physiotherapy. And by the way, very close to physiotherapy, similar training is sports therapists. The only difference really is sports therapists have far more of a focus on sports and performance and movement. I feel sports therapists are slightly underrepresented. So if you do find one, then fantastic, if that's the direction you want to go in. Osteopaths is the next one. They too, whole body, they look at how your whole body integrates, not just your musculoskeletal system, but also your nervous system. Look at how your whole body aligns. They may move you around a little more, and they're also medically trained. Chiropractors. Now, chiropractors focus more on the relationship between your joints, and particularly the joints of your back, your vertebrae. They will tend to move you around a lot more and even do some high velocity thrusts, so a bit of cracking for a quicker relief. Then we come on to soft tissue therapists, like myself. We're also trained to assess and treat musculoskeletal conditions, including things like nerve impingements. It's not just tight muscles, but other tissues, muscles, tendons, ligaments, and trapped nerves. You will get a lot more touch with a soft tissue therapist. So remember what I said, if you're drawn to touch, fantastic. If you don't want to be touched, don't go and see a soft tissue therapist. Find someone else. And you may also find that sessions are more relaxing, and that focus on touch to relax the body is higher than perhaps other modalities. I'd also distinguish between soft tissue therapy and more general massage or relaxing massage. Relaxing massage is great for helping you relax, for centering your body, perhaps for grounding you, also for reducing anxiety, but less clinical body work, obviously. So those are the main manual therapies. Of course, there are others, but these are the ones you mainly see in clinic and on Google searches. I would, however, like to mention a couple of other modalities where there is an element of hands-on, but they also start to touch on so-called energetics. So one is acupuncture, where they sensitively stick needles in the relevant energy meridians. But what we're finding is that those meridians, those energy meridians, seem to map, to some degree at least, onto the fascial trains, so the trains of connective tissue that we know about in Western medicine. So that's very interesting, and you may find you get a similar feeling of release. So the question there is, do you want to be touched more, or are you happy to have a needle inserted in the right energy meridian? And in similar vein, in terms of touch and energy balance, is reflexology, working on the feet and sometimes working on the hands. Again, some manual release, but also looking at the energy meridians going into your body. And again, we're starting to look at how those energy meridians actually map onto the physical connective tissue chains that we know about. So I hope that's been a helpful review of the various modalities. Obviously, there's a lot more to say, and I apologize to anyone who feels that they have more to give. Most therapists have more to give than just their qualification. Many may do massage as well. So it's worth looking at the individual approach of the practitioner, which takes me on to a summary of the two key principles. Check out the practitioner. Do they talk your language? Do they have an approach that appeals to you? And then what's the modality that you're most drawn to for helping you in not just a physical fix-it sense, but treating you as a whole person? I hope that's been helpful. Thank you for listening, and I'll see you in another video.